just persistent and relentless when I need to get something done. You know, if I think it's the right thing to do, I circle back. They have questions, I answer them, I circle back until it's done. I'm from a family of 4 kids and a father that was disabled by the time I was 12. My father was very focused on making sure all of his kids had professionally satisfying careers. I went to Dartmouth. I was a full scholarship student there. I trained as an anesthesiologist at the Medical University of South Carolina. You know, I picked anesthesia for a couple of reasons. I loved physiology and pharmacology, and it was the perfect marriage of those 2 specialties. And anesthesia was just interventional enough in a different way that allowed me to use my hands. It was a really interesting time at the Medical University of South Carolina. I had a lot of the women first. I was the first female clinical chair. I was the first female president of the medical staff. There was no standing on tradition or no standing on you haven't paid your dues. People were more of the mind, well, if you have the energy and the focus to work on this, you know, knock yourself out. And that's what I did. I was there for over 20 years. I was an unusual student. I worked at a local restaurant. I was a cook, bartender, night manager, waitress. And I tell a lot of medical students and residents that I learned a lot of great skills in food service because, make no mistake, healthcare is a service industry. There's something about the alignment of physicians, nurses, hospital leaders on serving patients. You're all in it together and you all have shared rewards and shared challenges. So when the position opened up at Dartmouth, one of my friends who I had actually gone to college with actually submitted my name. I interviewed with the search committee, and when they offered me the job, it felt like that was kind of my life and my career going in full circle. I never thought that I would end up back in Hanover. We laugh and we say that Dartmouth graduates spend 4 years trying to get out of there and 40 trying to get back. I think I probably fit the mold as well. Whether a small community hospital or a large urban health system or a rural academic health system, we all prioritize keeping patients safe, delivering the right care. Well, it's an incredible honor to be stepping in this role. I've got a lot of big shoes to fill. I've watched Wright, Lassiter, and John Halpert lead with both humor, humility, focus on the public good. I appreciate that so many healthcare issues are politicized in the U.S. now, and yet, you know, we need to bring people together rather than dividing them. I think what we can stand for is making sure that politics doesn't cross over into how we deliver care, because we can never let politics interfere with the science and interfere with how we're meeting the needs of our patients. Other things that I'm really passionate about are rural health care. You know, over 20% of the people in the U.S. actually receive health care from rural providers, and yet there hasn't been a lot of focus on some of the challenges in rural America. I think the AHA has embarked on really examining the principles and the pathways towards creating a financially sustainable health system. I don't think it's easy. If it was easy, we would have done it years ago. You can see some stress fractures in the U.S. healthcare system now. And I can list 4 very, very quickly. You can't find a primary care provider. You have to wait a day and a half for your prescription medications because there aren't enough pharmacists or pharmacy techs to fill those. You've had to have your outpatient surgery rescheduled several times because they don't have enough nurses to actually keep every operating room functional. And finally, you're sitting in the emergency room maybe for 6 or 8 hours because there are not enough staff to open every single bed in the hospital. Those are the stress fractures. We just have to figure out how do we actually address those pressures and mitigate them so our organizations can be there for the patients and the communities that they serve.